All right, let's get right into it. Today, we are breaking down a huge scientific review that looks at a question millions of us have probably wondered about. Should you really be taking antibiotics just in case when you get a tooth pulled?
I mean, chances are the answer is yes, right? It's one of the most common surgical procedures out there. And whether it was a pesky wisdom tooth or some other molar causing trouble, you know it is not a walk in the park.
You know, getting the tooth out is really just half the battle. The real success story is what happens after. And, well, sometimes things don't exactly go according to plan. Think about it. After an extraction, you've basically got an open wound in your mouth, and that wound can get infected. That can lead to some really unpleasant stuff. We're talking pain, swelling, fever, and a thing dentists call a dry socket. And trust me, it is every bit as painful as it sounds.
So, to stop all this from happening, what's the standard move? Often, a dentist will prescribe a course of antibiotics to take right around the time of the procedure. It seems pretty straightforward, like a simple, logical precaution.
Now, this has a technical name. It's called prophylactic antibiotic use. The key word here is prophylactic. You're not taking the medicine because you have an infection. You're taking it to hopefully prevent one from ever even starting.
And that right there leads us to the heart of the matter. We're all becoming more and more aware of the dangers of overusing antibiotics. So is this just-in-case strategy actually doing more harm than good in the long run? To find an answer, we're not just looking at any old study. We're turning to what's pretty much the gold standard in medical evidence, a Cochrane review. These things are massive, systematic reviews that pull together all the best research to try and find a definitive answer. And believe me, this one was a big one. The 2021 update brought together 23 different clinical trials, covering more than 3,200 people. So this isn't just one lab's opinion, it's a giant, comprehensive look at decades of research.
So what did they find? Well, the headline number is pretty eye-catching. The review found that giving antibiotics might reduce the risk of infection after getting a wisdom tooth pulled by about 2/3, a 66% reduction. I mean, that sounds like a total slam dunk, right?
But, you know, with statistics, the devil is always in the details. What does a 66% risk reduction actually mean for an individual patient sitting in that dentist chair?
This is where a fascinating idea called the number needed to treat comes into play. The review calculated that for wisdom tooth extractions, you would need to give antibiotics to 19 healthy people just to prevent one single infection. Let that sink in. That means 18 of those people are taking antibiotics with all the potential side effects for absolutely no benefit. And oh, it gets even murkier. When the researchers graded the quality of the evidence they had, they rated it as low for preventing infections and very low for things like reducing pain or fever. In plain English, that means we can't be super confident in these findings. The real effect might actually be pretty different from what the studies suggest.
And that brings us to what might be the single most important point of this entire explainer. Whenever we look at a scientific study, we have to ask who were the people in it.
So let's break this down. The vast majority of these studies, we're talking 21 out of 23, looked at a very specific type of person, healthy people, mostly in their 20s, having impacted wisdom teeth surgically removed, usually by an oral surgeon. So who wasn't studied? Well, older folks, little kids, people with weaker immune systems, and it also didn't really look at routine extractions for things like a simple tooth decay, the kind of thing your general dentist might do.
So here's the bottom line. The findings from this huge, important review might not even apply to a whole lot of the people who are actually getting their teeth pulled every day.
Okay, now we need to pull the camera way, way back. Because this isn't just about one patient, one tooth, and one prescription. Every single antibiotic we use is a tiny piece of a much bigger and, frankly, much scarier global picture.
And that crisis is antimicrobial resistance. See, every time we use antibiotics, especially when they aren't absolutely necessary, we're giving bacteria a little training session, a chance to evolve and get stronger. This means that down the road, those life-saving drugs might not work when we, or someone we love, desperately needs them. And this is not some far-off futuristic problem. The review points to some really sobering data from the CDC. In the US alone, there are over 2.8 million resistant infections every single year, leading to more than 35,000 deaths. Those are the stakes we're talking about. So how much is dentistry a part of this?
Well, the review points out that dentists are responsible for about 7 to 10% of all primary care antibiotic prescriptions. So while it's not the biggest piece of the pie, it is absolutely a significant one.
Okay, let's put all the pieces together. On one side of the scale, we have a small potential benefit for a very specific group of people. And on the other side, we have this huge, very real global risk. So, what do we do?
So let's recap. First, yes, there seems to be a benefit, but it's small. Remember, you have to treat 19 people just to help one. Second, this finding is based on low-certainty evidence and for a really narrow group of patients. And third, and this is the big one, every unnecessary prescription is like adding fuel to the fire of antibiotic resistance.
And that's why the final conclusion of this massive Cochrane review isn't a simple yes or no. It's that dentists and oral surgeons have to be thoughtful. They need to stop and weigh the evidence for each individual person and not just hand out antibiotics as a routine, automatic default.
And that really leaves us with the million-dollar question. It's the kind of tough trade-off that doctors and patients are facing all the time in modern medicine. When we put that tiny potential benefit for one healthy person on the scale against the massive growing risk of antibiotic resistance for all of us, where do we draw the line?